Good evening, everybody. I hope you can hear me. Confirm with a reaction if you can hear me loud and clear. Yes, thank you. Thank you so much, everybody. My name is Dr. Silvanus Manyala. I support with communications at PSK, and welcome to today's webinar as part of our International Women's Day commemoration. We have been running a campaign throughout this week, having begun on the 8th of March. And for today's session, we will be focusing on women pharmacists shaping Kenya's health future. So as you can see on the screen, this is our program flow for today. We will try our best to stick on the schedule so that we make the session very relevant and very productive. We are reminded that this session is already uploaded on the PPB's portal. Kindly log in to your online service portal and subscribe. Again, just a reminder that we have been observing the International Women's Day 2026 around the theme of rights, justice, action for all women and girls. This is a global commemoration day under the United Nations Women. And for PSK, this is a powerful opportunity for us to elevate the voices of women pharmacists who serve on the front lines of healthcare delivery across the country. And as you all know, pharmacists are often the most accessible healthcare providers in Kenya. Women pharmacists in particular navigate dual challenges. They are caregivers and professionals as well who understand the health impacts of the legal and social inequities on their patients, while also facing gender-based barriers within the profession itself. So the campaign for this week has been focusing on advocating for both women, and the profession itself, which serves the women within its ranks. And maybe just in a nutshell, some of the objectives that we had in mind while observing this week includes amplifying leadership, whereby we showcase Kenyan women pharmacist leaders as authorities on health equity and gender justice. We also were very intentional with regards to bridging health and law, where we connect the global theme for the International Women's Day of legal rights to tangible health outcomes for Kenyan women and girls. You might have seen quotes and tributes from participating members where we shared what they feel or what they think with regards to legal rights. We also were keen on driving engagement, generating conversation across our digital platforms, using very authentic and real commentary. And then, of course, lastly, we were very intentional with regards to encouraging the fraternity to advocate for policies that protect women's health and professional advancements. In a nutshell, this week has been very productive. We began with what I mentioned as quotes shared by our members. We did a bit of tribune on social media. We did a lot of updates as well, and we encouraged members to share the message along. And then, of course, today, which culminates the observation, we have our webinar, and I want to just invite Dr. Malesi, who is our moderator for today, to introduce herself and take it up from here. Thank you so much.
Asante sana, Dr. Manyala, for that introduction and that contextualization of the webinar this evening. My name is Dr. Malesi Shava. I am a pharmacist by profession. I am also an entrepreneur, and I am also involved in the space of project management. And this evening, I am your moderator for the session. Thank you all for joining us for this exciting panel discussion. As shared by Dr. Manyala, today's discussion takes place in the spirit of International Women's Day 2026, which, as mentioned, is being commemorated globally under the powerful theme Rights, Justice, Action for All Women and Girls. Locally, the Pharmaceutical Society of Kenya has marked this important moment through a week-long campaign, as we have been briefed, titled For the Women Who Heal Kenya, Rights, Recognition and Reform, which has seen us spotlight and celebrate our very own Kenyan women pharmacists playing an increasingly critical role in strengthening our health systems across different areas of practice, including community pharmacy, clinical pharmacy, regulatory affairs, research, policy, and leadership, to name a few. And yet, even as women form a significant and increasingly visible part of the profession, questions remain about representation in leadership, equitable opportunities, professional recognition, and the policies that shape the environments in which women work and lead. This evening's discussion is therefore both a celebration and a reflection. A celebration of the extraordinary women who are advancing pharmacy and healthcare in Kenya, and a reflection on the work that still remains to be done. We are honored this evening to be joined by two remarkable leaders whose work spans professional leadership, pharmaceutical quality systems, and highly specialized areas of practice. And together this evening, we will explore the journeys that have shaped their careers, the barriers that women in pharmacy continue to navigate, and the opportunities for mentorship, for advocacy, and reform that will shape the next generation of pharmaceutical leaders. So, allow me to begin our conversation by introducing our panelists. I will begin by introducing Dr. Elizabeth Itotia, a radio pharmacist. She is a highly experienced pharmacist with a proven track record in ensuring pharmaceutical safety, quality, and regulatory compliance. Her expertise spans good manufacturing practices, quality management systems, and regulatory affairs, underpinned by a deep understanding of pharmaceutical regulations and standards. She has successfully implemented and maintained quality management systems within pharmaceutical manufacturing facilities, contributing to the delivery of safe and effective medicines. Her professional foundation is built on a strong academic background. Dr. Itotia holds a Master of Pharmacy in Radiopharmacy and a Bachelor of Pharmacy. She is currently pursuing an MBA in Strategic Management to further strengthen her leadership and business acumen. She also holds certifications in quality management systems, reflecting her commitment to continuous professional development. Dr. Itotia is an active member of several professional bodies, including the Pharmaceutical Society of Kenya, Women in Nuclear Kenya, and the East Africa Association of Radiation Protection. Growing up, she held an unwavering belief that she would one day develop a cure for cancer. While the path to discovering a definitive cure remains complex, her resolute commitment to advancing patient care has guided her through an extraordinary journey. She channels her passion and knowledge toward implementing innovative strategies to improve treatment outcomes and enhance the quality of life for individuals facing health challenges. She strives for quality always. Asante sana, Dr. Elizabeth Itotia, for joining us this evening, and karibu sana. Our second panelist is Dr. Wairimu Mbogo, our very able president of the Pharmaceutical Society of Kenya. Dr. Wairimu Mbogo is a pharmacist, entrepreneur, and healthcare strategist committed to building solutions that serve both people and systems. Through her leadership at Nacha Pharmacy and Meraki Healthcare, she has demonstrated that success is not merely about innovation. It is about remaining grounded in purpose while growing through every season. Her career spans the complexities of corporate environments, business development, healthcare policy, community engagement, and personal leadership. She has launched brands, built high performing teams, advocated for stronger healthcare systems, and quietly held space for those who needed someone to believe in them. In a historic milestone for the profession, Dr. Mbogo serves as the first female president of the Pharmaceutical Society of Kenya in over 60 years of the society's existence. Her leadership marks a new era for pharmacy in Kenya, breaking a 6-decade barrier, paving the way for greater representation of women at the highest levels of the profession. Dr. Mbogo is a recognized pharma corporate strategist with deep expertise in regulatory affairs and intelligence, business development, pharmacovigilance, biotechnology, leadership and management, as well as the generic and specialty business environment in healthcare across the African continent. She is passionate about work that transforms lives, protects dignity, and creates lasting legacy. Whether leading a strategy session, speaking to youth, or simply being present for a friend, she brings faith, empathy, and clarity into every space she enters. Still evolving, still becoming, and always led by purpose. Karibu sana, Dr. Wairimu Mbogo, and thank you for joining us for this discussion this evening. Dr. Wairimu, Dr. Elizabeth, would you like to maybe say hello to everyone, even as we begin our panel discussion?
Yes, I can start. Thank you so much, Dr. Malesi, for the kind introduction. I am grateful for this opportunity and I look forward to the discussions that we are going to have tonight as women pharmacists shaping healthcare in Kenya. Thank you.
Asante sana, Daktari. Dr. Wairimu.
Yes. Thank you so much. Am I audible?
Yes.
Yes. Thank you so much. You know, sometimes a bio is read about you and you wonder who are they talking about, but it's an honor to just have an honest discussion about women leading healthcare in Kenya and the challenges and the barriers that we have to go through in order to sustain impact in whatever we do. Thank you so much.
Thank you both so much. And yeah, let's get right into it. So as we begin, we would love to hear a bit about your personal journeys. To begin, I'd like to just get a brief reflection from each of you on what inspired you to pursue pharmacy and what moment in your journey most shaped the professional that you are today. Maybe Dr. Itatia, we can start with you.
Thank you, Dr. Malesi. And there's no simple answer to that question. Most of us, when asked that question, you would say because you got the cutoff point, you got an A, and therefore you were selected for pharmacy. But for someone like me, I had selected pharmacy as my first choice because one day I was having a conversation with a friend of my mom, and she happened to mention that pharmacy is a good career. She probably does not know, but she made me start thinking about pharmacy as a career choice that I would want to pursue. But also when I was younger, and I've said this a million times, my parents used to come back home and from burying someone and say they died of cancer. And then I did not understand what this menace called cancer is and why it's killing so many people. And so I told myself as a child that maybe when I grow up, I'm going to discover a cure for cancer. And that's what led me to even select pharmacy as my first choice when we were selecting courses in Form 4. And what moment in my journey has shaped the professional I am today? I would say there are many moments in between that I can mention, but I can say that I was going about my day as a pharmacist and being vocal about it. And then one day I received a call from Nation Media telling me that I have been nominated as a top 40 under 40. And I remember sitting back and wondering why I'm being given this recognition because I just went and did a master's, and then I came back and was simply doing what I was meant to do by doing that master's. But I was also very vocal about what it is I was doing as a pharmacist. So that recognition has stayed with me to date because it reminded me that an authentic commitment usually gets noticed and the impact will usually exceed the expectation. Yes, have I answered the entire part of the question?
You have. Thank you. And thank you for that comment. An authentic commitment gets noticed. So recognition matters. Yeah. If I could just ask, you mentioned that a friend to your mother mentioned pharmacy or recommended pharmacy as a good career choice. Was she by any chance a pharmacist herself?
No, she was a school head teacher. But she happened to tell me that a few of her friends who are doing pharmacy as a profession are doing very well. And of course, when you're growing up, you want to do very well. So she said, maybe you should consider doing pharmacy. And that's the first time I ever considered pharmacy as a profession.
That's great. So maybe we can also bring in Dr. Wairimo into this conversation. What led you, Dr. Wairimo, to becoming a pharmacist? And if you could share a career-defining moment so far.
I think for me, thinking back, I always wanted to be in the healthcare space, but I wasn't sure, number one, and this is just out of, peer pressure and confusion, the way families tell you this could be better than this. But I always knew I did not want to be boxed in one place. So dentistry was out of the question. I did not want to be working at night. In my perception, I just felt I didn't want to, spend a day, quote unquote, touching patients or being woken up at night. So now medicine was out of the question. And then I remember I had a conversation with someone just randomly when I finished high school, and even during that confusion, my parents felt it was a good idea that they get me a place at the Aga Khan Hospital where they used to do a volunteer program. So you're placed with in the HR or the scheduling center for doctors, so you get to interact with them. Then within that, I remember going to the dental clinic. And I remember I was there for 1 hour because I could not withstand the drill. And I went and told my supervisor, no, I've already decided I'm not going to dentistry. And I know there's a very senior pharmacist who may not know, two senior pharmacists. I went to the pharmacy department, and I remember I just saw they had this recognition board. So they would have stars for people who are doing well. They were having, you'd have stars for the week. And then for me, that was very exciting when I was young, being a young person, though I still did not like the hospitals. So this is Dr. Joyce Ndwati and Dr. Elizabeth. I know Dr. Elizabeth is now in Kijabe, and Dr. Joyce Ndwati is now back to Aga Khan. But these are women who shaped my decision. And one day, I remember the accountant came to pick bills, and he just asked me, "So what are you thinking of doing?" Then I told him, I think I like pharmacy because I want to do pharmacy, but people feel that medicine might be a better career. But he just told me, pharmacy is a simple, well-paying job. And I think I just made up my mind then. And yeah, I went into pharmacy school, knowing that it was a simple, well-paying job. Simplicity is relative, but that's a story for another day. But that's how I ended up becoming a pharmacist. In terms of now what shaped my career, and I keep saying I'm a product of mentorship. I remember Dr. Kathy Otieno walked into class during electives, and I just decided that's what I wanted. What she describes she does is what I sort of figured out. I just want to be in the corporate space. This was very new to me. I didn't know about that aspect. I just figured that this job will not require me to talk to people the whole day or touch or just be in a hospital environment where I'm just there the whole time. So that's how I ended up becoming a pharmacist. Then when I left, my first shaping career was at Laborex. And then from there, I keep saying it is the effort that you put in that, that ended up growing. Worked for Adcock Ingram, doing regulatory affairs and a bit of business development for the East Africa region. Then from there, I went to Roche, where I was doing all sorts of roles, from regulatory policy to compliance, to market access, to a bit of business development, and also policy shaping. And then I went on to become an entrepreneur. So all those sections are career-defining moments. And then now I am mainly purpose and impact driven. And that's what led me to running for president, because I felt it's about time that if you feel that change is coming, you need to be part of that change. So for me, this is an attempt, and I'm very happy with the support that I'm getting from members. Of course, it's a challenging role, but it's also a very defining moment for me. So yes, so that's basically a snapshot of why I became a pharmacist and the defining moments that I have had within my career.
Thank you. Thank you for that. I know it's just but a snapshot. It's very difficult to summarize some of these things in a short 2-minute answer, but thank you for sharing. So very interesting similarities in your answers, in that, everybody wants to do well. You have heard that pharmacy is, a career where you can do well. Maybe some of us, just like you, Dr. Wairimu, I also did not want to touch patients and see blood. And so I thought, okay, pharmacy might be the best way to go since I want to be in the healthcare space. So you have decided to become a pharmacist. You are now in, a school of pharmacy and pursuing it. And maybe you have even graduated and now you are a young pharmacist looking for employment or the way forward in terms of your career. What was the actual experience qua ground? Was it what you expected? Are there particular challenges that you may have experienced on your road to where you are today? Dr. Itotia, maybe we can start with you.
Thank you, Doc. Probably here our answers are going to be different. But before I answer that question, I wanted to also touch on what Dr. Wairimu has touched on, the role of mentors. And I know we are going to touch on this later, and being the people who sometimes come and define your moments, or sometimes come and help you decipher what it is that you want to do. To give a very practical example is when I got a job and then I had a scholarship at the same time, and Dr. Wairimu would tell you I was between a rock and a hard place. I did not want to quit the job, and I also wanted to take the scholarship because I knew the hardships that come with not having a job. And so when you talk to people who have gone before you, and that time I was seeking advice from a lot of people, including our very own Dr. Wairimu, they're able to help you be able to navigate certain situations where when you are younger, you would think they are very hard situations. So in short, you walk on the shoulders of those who have walked before you. Now, for me, the situation on the ground, and probably this story starts it off, it was very hard. And if you have young pharmacists on this panel, probably this is for you. The situation was extremely hard because I happened to be in the lot of pharmacists that do not get employment post-internship. So you've moved from a very well-paying internship season, and then you come outside here and there are no jobs. You walk from place to place, and the salaries you're being offered is 1,000 a day or 25,000 a month, etc. And at that time, you're the star of the village. You are the daktari. Your parents are introducing you as daktari. And therefore, it became a very tough year. Post-internship, 1 year post-internship was a very tough year for me. But eventually, through a lot of things, through doing a lot of things that we are still going to touch on later, including interacting with people, not just staying in the house and sulking, but putting yourself out there, I was able to eventually land my first and my second jobs. Yeah, so it was not as easy as I would have anticipated when I was going into the career. Thanks.
Thank you for sharing. What about yourself, Dr. Wairimu? was there a particular challenge that you can say really made you reflect on your choice to pursue pharmacy as a
Um, I think I wouldn't say I have ever regretted pursuing pharmacy, but I faced difficulty. I think I would want to say that when I went to Laborex, or what we'd call the corporate world, I quickly had to discover, systems and how structures, anyone who gets into any system needs to understand how to rise through that system. So you get into a system at maybe, and you finish some pharmacy schools, and people finish at 25 on average, 24, 23, 26. So the moment you get into any career, you're not getting there to stay there. So you're looking to grow. So the biggest hardship I ever faced was to discover that for me to ever become a CEO of a corporate unit, whether it's in the multinational, any pharmaceutical unit, whether I will go into the multinational world, whether it will be my own, whether it will be a distributor, is to understand that you have to learn how to sell, because that is the single unit that makes that pharmaceutical business survive. Then secondly is you have to be so good at the technical part of it. So the selling part is what was the most difficult, because it meant that I had now to go back and look at process and say, for me to know how to sell, it means that I have to become a rep. And what does becoming a rep then as a pharmacist, who may have left employment? Please note, I was in the cohort that used to be posted after internship. And I think I discovered very quickly that this was not going to be my ladder for growth in terms of what I wanted to do. But now going back to an area where you have to go to downtown, because that's where most of the customers or the big customers were. Now they're in better places because they're in nice warehouses. Back then they were all in downtown. And just figuring out that this product has to move, and you're the pharmacist who has to make sure that this product gets sold. So being a rep was a really defining time for me in my career. But I remember, as tough as it was, I needed to tell my mind that this is a process to something. So even for those in the room listening, and those in that space, just know it is a process to growth, because the pharmacist who gets it right, in terms of understanding the commercial principles of the sustainability of a pharmaceutical business, is the one that grows to the highest level, because you're the one who will understand compliance. You'll understand the importance of why compliance is important, why you have to invest in compliance in order for the business to remain sustainable. So that was the most difficult part of it. But I believe that when I started seeing results is when now I think I got the hang of, there's difficulty, but there are results. The results speak for themselves. So that would be my most difficult moment when I say of my career in terms of just understanding the industry for me. Yeah.
Thank you both so much for sharing. It's interesting to see how one always imagines the grass is greener on the other side when it may not necessarily be the case. Like Dr. Itotia, I also was not part of a cohort that was, in our eyes, fortunate enough to receive direct posting. So some of our challenges were similar in terms of the tarmacking and trying to figure out, where next after the nice cushion of internship. But as you have shared, Dr. Werimo, there were also other challenges on your end, despite the direct posting and having to figure out how to work your way up the ladder within the workspace. And that gives us a great segue into the next segment of our discussion, where we want to now look at leadership. and breaking leadership barriers. So I will direct this question to you, Dr. Werimo, again. You are currently serving as the first female president of the Pharmaceutical Society of Kenya. Again, as I would like to repeat, in over 60 years of the society's history. So what does this milestone represent, not just for you personally, but for women within the profession more broadly?
Um, I usually like saying that, yes, I am the first female president, but it just happened. I believe I am a leader who just happens to be a female or a woman. So the female aspect, I would say, is more cosmetic than actual, because I believe leadership is framed within certain attributes and qualities that come. For me, my leadership portfolio is very impact and purpose driven. So it's about what improvements are you making within the system that you are in. And for me, it's about speaking about the inclusivity of, women leadership, recognizing that there are barriers that are very unique to women. And also within that, understanding that you cannot make excuses for those barriers. So traditionally, we know that there are certain expectations of women. Women are supposed to behave, be seen. They're supposed to do certain things in a certain way, but life does not. It's about realizing that life does not work like that. In life, if the road to Mombasa is Mombasa Road, you have to drive on Mombasa Road. You cannot use any other road. You might use a bush, but it's going to be very difficult. So it's just recognizing what are these key pillars of what you want to achieve. And for me, it was about, finding some form of structure in what you're trying to do. So for me, it was epic at that point. So it's about, we need education, we need policy, we need innovation, we need collaboration. And we need to feel that we are epic, because we are actually epic, but do we actually feel it? And can we brand ourselves as such? The other thing that has been very key in a lot of things that I have done, because this is not the first new thing I would say I have done, has a lot to do with boldness. It has a lot to do with asking, what is the worst that can happen? So if you lose, if you run and you lose, what is the worst that can happen? You'll just go back to your work and continue doing whatever you are supposed to do, but you tried. So do you want to live with the purpose of I should have tried, or do you want to just try and see what happens? So for me, those have been some of the driving factors that now eliminate the boundary of that I am a woman. But I also recognize that being a woman in this position is also advantageous from an institutional perspective, from a visibility perspective, in very many spaces. In spaces where people would see the woman as an advantage within that leadership structure. So for me, all I would ask for members is to just get involved, love your profession, get involved. A very wonderful, passionate team that is behind PSK, that is ready to drive it to where it's supposed to be as a 60-year-old organization.
Dr. Itotia, I would love to also hear your insights on this. What message do you think it sends to young women pharmacists about leadership possibilities? The fact that we now have our first female president of the Pharmaceutical Society of Kenya.
Let me first start by saying that Dr. Wairimu's answer to the previous question and to these questions are probably things that we need to be deliberately taught in school, but we are not. So unfortunately for all of us, we have to go through the lesson of life for us to learn these things. That sometimes, and I like what she has said because it is absolutely correct, that you need both the technical, but you also need to know how to rise. Because if you are aspiring to rise, of course, and leave the technical space. So it comes, you get into the corporate world, you get into the job market, and you realize, my God, it's not as easy as we would have expected. The barriers that people used to tell us when we were younger and we were in school actually do exist. But I also like the boldness that Dr. Werimo is saying, that she likes that she just happens to be a woman in this position when the rest of us are really celebrating her and keep on quoting that thing of the first woman in 60 years to be the president of PSK, because we do acknowledge that the barriers do exist, and we face the barriers the longer you stay in the field. And I also subscribe to the notion that I will just try it and I will just do it, even if I'm scared, because I came to just realize that I think everyone is scared. They are just bold enough to do it scared. So nowadays, my mantra is do it scared. So even in leadership, even in vying for those positions, even in applying for whatever opportunities that may be presented your ways, I may feel I am not confident enough. I may feel I am not ready for the position. The world may tell me I should not do it because I will be attacked. People are going to look for that and use it against me, etc. And then I'm like, what is the worst that can happen? One, it helps me grow a thick skin, and number two, I just go back to my work. If things don't work out the way they are supposed to work out, but of course you hope for the best. And being a woman, you find that now there's an advantage that comes with being bold and being able to take up those opportunities when you're scared, because not many of us are able to come forward like that. Most of us would prefer to stay in the comfortable position. And because we have to acknowledge that we still live in a highly patriarchal society, you will find now that when you're a woman and you are occupying certain positions, you will be at a strategic advantage compared to everyone else. But of course, the purpose remains for us to create the way and remove the barriers for the women who come after us, because the women who have come before us have done a lot, even if we still have a lot to do. Thank you.
Thank you so much for that. I really encourage, and I hope my fellow pharmacists listening are also feeling encouraged. Do it scared, be bold. Everyone is scared, but they're just bold enough to do it scared. I like that. So moving on to systems and professional leadership. Dr. Irimo, having worked across corporate strategy, regulation, and professional leadership, where do you think the biggest structural barriers still exist for women? You mentioned that as women, we do face particular unique challenges. And where do you feel that these structural barriers still exist for women when it comes to leadership in pharmacy?
I think I'll start with the obvious one, where we have a lot of pay disparities, where there's no transparency in compensation, or even where there are some pay scales, you'll still find that women tend to sort of be paid less than men in the same position. And this I speak especially when it comes to leadership. And everywhere that I go, I keep telling organizations that they need to be more open with their budgets for positions, and that they're not saving any money by paying anyone less. That's one of the most common ones. The other thing is prejudices against women and their social systems. So you'll find that a lot of women will be defined by, probably, I don't know, marital status or things that have nothing to do with their roles, quote unquote. And I think I keep telling women, don't tell people, like if you're getting into certain spaces, stop defining yourself in terms of your social status. Stop saying whether you're married or not. Stop saying whether you have children or not, whether you have family or not. Because sometimes those prejudices have been used for and against women in certain ways, as opposed to the decisions that they choose to make for themselves and with themselves. The third prejudice has to do with people's thoughts about who you are, I guess. And that now goes hand in hand with self-awareness. One thing that I feel, or anyone who comes to me and we go through the whole personal, I don't want to call it personal branding. There's a name that we give it, but personal self-awareness is, you have to know yourself beyond what others know you, and you have to understand, what your blind spots are. You have to understand what your strengths are, what your weaknesses are, and even just accept them as they are. Then from there, when others decide to define you have a very clear understanding of who you are and who they think you are, and why they are defining you in certain spaces. And is it a weakness that is causing that? Is it so? That self-awareness allows you to sort of curate yourself and put confidence to the tasks that you're doing, despite what the thoughts are. So the one thing that works for leadership, and especially for women, is just having very clear objectives, very clear accountabilities, and very clear ways of how, whatever you're putting out there is going to be measured. So the moment you have clear objectives, how you're going to achieve them, it removes a lot of barriers, because you now get to the point where you say, this is what needs to get done. And this is how I feel it needs to get done. We also need to learn how to, women especially, were taught that I think there's a difference between being confident and being humble and being cocky. So women need to be very careful around that whole definition, and it just comes back to self-awareness. So you have to, the fact that others are so ready to define you, especially in certain spaces, you need to define yourself so well that when they define you, there is a distinct difference of who you are versus who they think you should be. So self-awareness is the one thing that I usually say has helped in many scenarios to define and shape some of the successes that I have had in different areas. Yeah.
Thank you. Thank you for that and for bringing up the issue of self-awareness and not letting others define you, not letting the prejudices of others define you. As we move into the topic of innovation and specialized pharmacy, I would love to hear from Dr. Itotia on how she found herself venturing into the space of radiopharmacy. This is an area that is highly specialized and often male dominated. I believe we know, or maybe some of us have heard of some of the prejudices that exist to sort of warn women against going into this space. So what inspired you to pursue this path? And what has your experience been like navigating such a specialized area of practice?
Okay, thank you, Doc. So interestingly, my journey into radiopharmacy started as a chance. It was a bit of chance, not something I had planned. And honestly, I jumped into the opportunity for fear of tarmacking. So I gave the story of how the experience was post internship. And so one day, one of my professors, Professor Mugune, told me about a scholarship opportunity about radiopharmacy. And to be honest, we usually do a unit in radiopharmacy in the second year of pharmacy training, but I did not know it could be a whole pharmacy specialization. But because I was in the tarmacking phase anyway, or as I was about to enter the tarmacking phase, I was 1 month to finishing internship. I just told her, yes, I would be interested. And then later I just did my research, which gives us the lesson that I have been told by a lot of mentors along the way is when opportunities come your way, you first say yes. And then you find out what the opportunity is about later. If you're not interested now, then you can say no. Now, of course, what I discovered was a good realization because radiopharmacy was sitting at the intersection of pharmacy, nuclear science, and oncology. And remember, I told you that when I was a child, I always wanted to discover a cure for cancer. And when I discovered that radiopharmaceuticals are mainly used in the diagnosis and treatment of cancer, then I was like, maybe this is where I want to be. Because before radiopharmacy, I had thought I would do a master's in drug discovery, industrial pharmacy with drug discovery. So this was kind of doing the same thing for me. So navigating this specialized field, and you have mentioned about the biases that exist, especially for women. Of course, it's challenging, I'm not going to lie, but also deeply rewarding, especially for those people who are getting into it as the pioneers, because the field is pretty new in the Africa region, not only in Kenya. It's a bit developed in the other world, but it's a bit new. But because of those biases and misconceptions that exist, the specialization also remains extremely rare worldwide. So the first thing that you'll be warned about as a woman is you'll be told you will to take care of your reproductive health. For example, we do get kids with the radiation exposure, and yet the people who have been working with this for 50, 60, 70 years, they are fine. Because the way the work is designed is such that this amount of radiation is not, you're not, sometimes you're as safe as working in a normal pharmacy. You will get no exposure. Yes, there's radiation being produced, but the engineering is such that nothing is getting to you. But of course, that's a story for another day. But of course, a man would not be discouraged from getting into that field, because I don't know why people would assume that the radiation, assuming the radiation was harming us, that the radiation would harm the woman and not the man. Again, goes into the cultural entrenchment that we are taught that as a woman, you can only go for certain things, but men can go for everything. So we will have sessions, or we have had sessions in the past where we will tell you what radiopharmacy is about, how we do protect ourselves, etc. But what I can say is that it has been rewarding, but it has also been challenging to be able to navigate the field and to be able to convince people as a woman that you can be able to help them be able to start a radiopharmacy practice in the institution. And then you go through the interview. I remember there's one place I went, not my primary workplace. They was looking to start nuclear medicine services, and they wanted to have radiopharmacy component as part of it. So they were having the conversation. And so when I went, because I'm popularly known as Dr. Itotia, so first they were shocked it's a woman. Two, they were shocked at how that time I was small. I think I'm not so small now. They were shocked at how small I am. Three, they were shocked at how young I am. So these biases will always tend to be there, because I asked myself, if it was a man the same age, the same features, would they have faced the same biases that I faced? But of course, the moment you show that you can deliver and consistently deliver, because you really have to be good at what you do. As a woman, you have to, sometimes you're told you have to work twice as hard. It might statement becomes true, especially as you progress up the ladder. So you have to continuously prove yourself that you can be able to deliver, even in spaces where you're not expected to deliver. And that is what I have aimed at doing and continue to learn how to do as I progress in this journey. Thank you.
Wow, thank you so much for that. I will be very honest and say that during my internship, the oncology, particularly because of the radioactivity, was one area that I did not enjoy spending time in. But as you have shared, it is actually an area worth exploring. And I hope that for all the young pharmacists or students that are listening today, when opportunities come your way, we have been told to first say yes. So still on you, Dr. Itotia, on patient safety and systems thinking. Your work focuses heavily on quality systems and regulatory compliance. So how does strengthening pharmaceutical quality and safety ultimately translate into better patient outcomes, particularly for vulnerable populations?
True story, I will tell you that I don't know how the pharmacy training is normally done, but by the time we are coming out, it's usually entrenched in us to think about safety and quality. And I'm saying this having worked with other cadres within the same work environment that are not pharmacists, and you will find that we are more quality minded as compared to other cadres. I don't know. It's within the training. It's within our training. But we must remember that whenever we talk about pharmaceutical quality systems and regulatory compliance, safety net for every patient. Because remember, this patient, when this molecule is going into them, they will not know. They will trust that the drug will work. They will trust if you tell them it's an anti-cancer, if it's for therapy, if it's an antibiotic. It means they trust that we have done our due diligence as pharmacists to be able to ensure that they are safe, or at least no harm is going to come to them because we did not do our part. So this means that every medicine that is administered, especially to vulnerable populations such as children and the elderly, but I don't like even sometimes saying especially to, I think it's to every patient. You must first ensure that it's effective, it's consistent, and it's free from harmful contaminants. When we were in farm school, there's a lecturer for pharmaceutics who used to tell us that you cannot test quality. So if I give an example for radiopharmacy, we build a quality system such that even if we are doing quality control on the drug, we'll do HPLC, we'll do GC, we'll do ETC, we have built quality into the system. And that lecturer used to give an example of microorganisms, that there's no single media that exists that can support the growth of all microorganisms that are known to man. So even when you test the sterility of the product, you will be just checking what is commonly known. But what if your product has what is uncommonly known? And therefore, you have to build quality into the system. And that's what nowadays I enjoy doing. So we ensure that quality systems, we are not just ticking regulatory boxes because PPB will come to us. We are the backbone of trust between the drug and the patient, and we must do what we must to ensure that our patients remain safe and they get what they're supposed to get.
An important reminder that pharmacy goes way beyond just dispensing at a counter. Thank you for that, Doc. So on to mentorship, and this is directed to both our panelists. Mentorship often plays a critical role in shaping careers, and you have both spoken quite a bit about that. What role do you think professional bodies like PSK play in building mentorship pipelines? Maybe we can start with you, Dr. Irimo.
That's a very interesting question because that's a conversation that I had today with some people who do executive coaching, and we were trying to define what systems would work in a sustainable way for mentorship to happen even within a professional body. But maybe I can speak about the opportunity that I see from an opportunity perspective. From an opportunity perspective, it is the fact that we have everyone inside PSK. So we have the young pharmacists, the early careers, we have the middle-aged pharmacists, we have various sector groups, we have the experienced, I like to call them our golden oldies, our registration, I don't want to mention downwards. But for me, it's just an equation of how do we create the bridge between all these experiences such that we're learning from each other. Because mentorship is two-way, by the way. It's never a one-way street. There's a lot that you can learn from the young, especially in the age of digital literacy and this whole AI era. And there's a lot you can learn from our more experienced pharmacists in various sectors. And for me, I think I am intentionally working with the teams to see how we can bridge the gaps, whether it is at national level and especially at branch level, where branches need to create spaces like the one that Nairobi branch and Tana Athi branch had, where people just meet, interact, and just get comfortable around each other. Because the moment people are now comfortable with each other as pharmacists is the moment now we break the barrier in terms of making sure that you can support each other. But from a systems perspective, we are working to actually see how we utilize that opportunity to ensure that it works for the pharmacists. And I know we shall understand, we shall get it very, very soon. Yeah.
Thank you, Dr. Wairimo. Dr. Itotia, what is your view on how professional bodies such as PSK can, build up mentorship pipelines for the upcoming
Okay, thank you. And it's amazing to hear that PSK is planning something, because a lot of us, especially when you're starting your journey, you would want to be able to be guided by someone who has done it before you. And if there's a formal structure for this to be done, it will really be helpful to our younger colleagues. But if I'm to give my own experience, I would say that mentorship is everything. I would say that some of the most impactful guidances that I've received in my life have been through mentorship, and sometimes mentorship can be formal or informal. It can come formally, where you have structures like in PSK, you have a mentor you have identified who you meet structurally, and you do mentorships and they guide you through your career. Or it can be informal, and I'll combine this with networking, and I keep on telling people that informally it can just be as a result of being at the right place at the right time, or ensuring that you are purposeful in where you are. And this is where I'm going to bring in the conversation of societies such as PSK, that PSK is holding its annual conference, PSK has a team building, PSK has all these events that they hold, PSK needs volunteers. These are the opportunities that you normally get to interact with people who you would normally not get the opportunity to interact with. So if you have always wanted to go to talk to Dr. Wairimo, maybe you would easily get to talk to her if you attended an event where she's in attendance, a formal PSK event where she's in attendance, than you trying to schedule an appointment with her, because I can promise you she probably gets over 100 people asking her to be mentors. Sometimes, and I struggled with this, and I'm going to use my own real life experience, that when you're younger, you still also don't know how to approach people. You do not know how to go to Dr. Wairimo and tell her, can you be my mentor? And sometimes it's even awkward for Dr. Wairimo, because she does not know how to mentor. We have not connected, because sometimes it needs to even get personal. But you just being in the right room at the right time, sometimes even saying nothing. But I will remember there was this young pharmacist who was here, and they volunteered, and they need this opportunity. PSK, the role of organizations like PSK, my first job ever was through PSK. So I would attend events as is necessary, and I would establish contacts as is necessary, and I would keep on texting those contacts that I am a pharmacist and I have finished internship and I don't have a job. And then periodically after 2-3 weeks, I will still do the same. And so one time, the then president was presented with an opportunity, and since I had been texting them so many times, they forwarded the opportunity to me, and I was able to get the job. And I moved from the ranges of earning 20,000, 30,000 So the role of professional bodies cannot be understated. It's where you will get to do what you're meant to do and be able to rise as a professional. It's also where you hear about opportunities, because if you just stay in the house, how will you ever know what is outside there? How will you ever know that there are pharmacists who are doing beyond the conventional pharmacy practice if you are not interacting with them within the professional body? Thanks.
Thank you. And yes, of course, we're all happy to hear that PSK is working on something. But I think there is a repeated reminder again to be bold, take advantage of the opportunities that are available to us, even through, things like the conference and other networking opportunities, and approaching those who we feel we may be able to learn something from. Thank you so much for that. On to wellness and work-life integration. Women in healthcare often balance multiple roles as professionals, leaders, and caregivers. How have each of you navigated sustaining your personal well being while pursuing demanding careers? Dr. Wairimo?
So I want to be honest and say that is a question.
Sorry, Doc, I think we lost you, or it's a bit shaky.
We are okay, just I thought you can answer
Okay. Okay, maybe we can start with you, Dr. Itotia.
Okay, thank you. You've talked about balance.
Yes.
To be honest, and having talked to a lot of women and having also read widely, I don't think balance exists. And one side of our life will always have to sacrifice for the other side to be successful. And the moment you actually learn this is the case for everyone, you make peace with it. You will hear the term work-life balance, especially when it comes to family, is mainly going to be used on women and not men. And these are the cultural biases that we keep talking about. So there's a book called Lean In by Sheryl Sandberg, and it clearly communicates this, that there's no perfect balance, and trying to find it can make you feel like you're failing and start feeling guilty. So knowing that this is true for everyone means that you do not beat yourself up when you one day in the week have to spend more time in the office than is required, and therefore if you have kids, you miss the homework that day. But for me, the practical approach I think I have chosen to take is to just take life in seasons, that this season can be my career season, and therefore I'm going to do everything humanly possible to rise in my career. Or it can be my family season, and if my body asks for rest, it asks for rest, regardless of what I am missing outside there. So I am going to show up fully depending on the season. So my advice to us, and I am just saying this without a lot of experience, is to accept that perfection is not a goal. So we focus on doing your best, depending on the season that you are in. Of course, we must always prioritize our health and never to feel guilty for the areas that get less attention. And even when you feel that guilt, remember it's all of us who are struggling with the balance. So burnout, of course, we will get us, but it normally comes when we fight the natural flow of things. So we must embrace the seasons and just pivot intentionally as life demands. So if one day I am invited to a session, I know it's really important, but I have a conflicting thing with family, and I chose the conflicting thing with family, I might feel guilty. I might feel like I have lost the opportunity, but I should know everyone is going through the same struggle and no one can really ever find that balance. And when we accept this reality, I think it becomes easier for us to be able to navigate the professional ladder and be able to grow as it may. Thank you.
Thank you for that very honest reflection. balance, yes, I mean, it's debatable. Does it exist? Does it not exist? But the reality is, as you have said, we should never be striving for perfection because that is not human. And so we need to just go with the seasons and accept where we are in life at a particular time. I don't know if Dr. Irimo, you're able to chime in on that particular topic at this time. Okay, even as we wait for Dr. Irimo to maybe share her thoughts with us on those particular areas of discussion, maybe Dr. Itotia, you can share, if we were to reconvene 10 years from now, what change would you most hope to see for women in pharmacy in Kenya?
Okay. So looking ahead 10 years from now, I would love to see a Kenya where women in pharmacy are at every table, fully included, of course, fully respected, and not questioned or second guessed because we are women. So I hope for that profession where leadership, decision making, and influence will reflect our true talent and contribution, not because necessarily we are women, but because we are also leaders. I also hope that we can be at a place where the young women that are entering the pharmacy profession can see role models everywhere and feel empowered to take up space, and know that their gender is never a barrier to making impact. Because sometimes, and Dr. Irimo clearly brought out this really well, that sometimes you are made to believe that because you're a woman, you can never do this. So if in 10 years we can be somewhere where boys and girls, we know that gender is never a barrier for me making an impact, and therefore I can make any impact that I want to make. So ultimately, I hope we reach a point where the question isn't whether a woman belongs in leadership, but how we can all work together to shape a stronger, more equitable pharmacy profession for everyone. And as I am talking about that, and to demonstrate the thing I talked about earlier about doing it bold and being able to take up space, I would want to mention that I am vying in the upcoming KMPDU elections. I am going for the National Deputy Treasurer. Because one, I believe that as pharmacists, we need a very strong voice in our union. So a union without pharmacists, and there are very many, or there's a splitter union that has already been formed without pharmacists. Is it complete? So we must ensure that our concerns, our career growth, our working conditions are represented and prioritized. So I am asking for those of us who are in this forum and you are KMPDU members, I am asking for your votes as your National Deputy Treasurer, and I will ensure, despite the advocacy and the unionism, that also our resources are managed with transparency and accountability. As I represent pharmacists on the table, I want to be the voice that ensures pharmacists are never sidelined and always recognized for the critical role that we play in healthcare. Thank you.
Thank you so much for that, Doc. And we can see you are truly, walking your talk in being bold and doing it regardless of what your internal feelings may be. We wish you all the best, of course, as you vie. I don't know, Dr. Irimo, whether you're maybe able to share your parting shot with us now, even as we come to the end of the session.
Yes, I know you'd ask about wellness. I think
Yes.
it's important. The other day, I was just watching something that was saying that you have to imagine your life as a banner, like it has four banners. So there's family, there's work, there's friends, and there's probably wellness. And you'll never get all four banners working. I don't think in anyone's kitchen that they open all their banners at the same time. It's about just
prioritizing what is a priority for you at that point in time. And sometimes your priorities may upset others in one way or another, and you just have to be comfortable with them. And because we say we only have one body to live in, it is important to integrate, wellness, some form of healthy habits into our spaces, whether it's what you eat, whether it's exercising, whether it's mental health. It's important to integrate that because you have no other body to live in that allows you now to be with family, friends, and also allows you to work. So with that perspective, I think it's about progress and not perfection. So what 1% can you improve of yourself every day? And I think that has sort of
Dr. Wairimo, can you hear me? I think we may have lost you. I hope I'm audible. Maybe can everyone else hear me? Maybe just thumbs up. Okay. Thank you, everybody. I think we have lost Dr. Irma temporarily, but we hope she'll be able to join us for some, a concluding remark. But I would just like to thank everybody for the insights that have emerged for and I'd like us to just recap a few things or takeaways from this. First of all, representation really matters. The presence of women in leadership positions, whether in professional bodies such as our very own PSK, healthcare institutions, learning institutions, as we have had so many stories of mentorship that came through learning institutions, healthcare institutions, research or policy spaces. It's not simply symbolic, it means something. And it really does shape the priorities, perspectives, and policies that influence how healthcare systems serve our communities. Second, the future of the profession depends on intentional mentorship and support for the next generation. Young women pharmacists and students listening today, and I hope we do have a few who have joined us this evening, must see not only what is possible, as we have heard today, but also feel supported to step forward into leadership, innovation, and policy influence. These reflections bring us back to the spirit of International Women's Day 2026, the theme being rights, justice, action for all women and girls. The message is clear. Progress does not happen automatically or by chance. It requires deliberate effort to dismantle barriers, strengthen systems, and ensure that rights are not merely promised but truly experienced. Through its campaign for the Women Who Heal Kenya, rights recognition and reform, PSK has created an important platform to spotlight these conversations and to reaffirm its commitment to advancing gender equity within the profession. To our distinguished panelists, Dr. Wairimo Mbogo and Dr. Elizabeth Itotia, thank you so much for sharing your insights and your vision for the future of pharmacy in Kenya. And to everyone who joined us this evening, thank you for being part of this conversation. We hope it was both insightful and inspiring. I am wishing you all a wonderful evening. And if we do not have any questions, I would like to hand the session back over to Dr. Amos Manyange. Thank you, everybody, and have a good evening.
Thank you, everyone. I hope you can hear me.
Yes, we can hear you.
Thank you, Dr. Erimo. I think I'd like to thank everyone for taking their time and attending this session. I'd like to thank the panelists, and I'd like to do a few announcements. First of all, we have 46th PSK Annual Scientific Conference. The dates of the conference are 24th to 26th June 2026. The venue is Pride in Paradise in Mombasa, and the theme is Pharmacists Leading Transformation and Innovation Towards the Highest Attainable Standards of Health. We have important dates that we all need to take note. At the moment, we are at early bird tickets, which closes on March 31st. Early bird rates for students is 18,000 shillings, for members 24,000, for non-members 34,000, and international delegates is 350 USD. Kindly members, we encourage everyone to log into the portal and register for the event. Grab the chance and take the early bird ticket before the deadline. Another thing is to notify you that the call for abstracts is out, and we have the guidelines on the conference website. We have 4 category areas to focus on. Pharmacists as pillars of health system strengthening, role of pharmacists in policy, regulation, and professional direction, pharmaceutical sector growth, focusing on local manufacturing, market access, and supply chain resilience, digital health and innovations in the pharmaceutical sector, and lastly, thrive, lead, and stand for what's right, the human side of pharmacy practice. The submission deadline is Wednesday, 15th April 2026. Another announcement is to notify all that this webinar is on the PPB portal. Kindly subscribe, and if you have any inquiries about CPD, kindly share your email to cpd@psk.or.ke. And if you have any challenges with the PPB portal, kindly visit the FAQ on the PPB website under CPD, and you'll be able to get all your questions answered. If nothing is answered or there's something else that you need more clarification on, kindly email cpd@psk.or.ke. We have an upcoming event at branch and national level, World Kidney Day webinar. This will be on Tuesday, the 17th of March, 2026, and this event will also be CPD accredited. We also have a virtual event that is PSK Members Feedback Forum. This one will be on Thursday, the 19th of March, 2026 at 7 p.m. And kindly connect with us on our social media platforms. We are new to the TikTok scene. Kindly follow us at Pharmaceutical Society of Kenya, and also join us, follow us, like, subscribe, and share our content on LinkedIn, Facebook, Instagram, X, YouTube. All our webinars are uploaded on YouTube. So if you miss any webinar, you can be able to find them on YouTube. And also our channel on WhatsApp is the Pharmaceutical Society of Kenya. Thank you, everyone. I'd like to wish everyone a lovely night. And if there's any question, kindly on CPD, kindly reach out to the email shared earlier. Thank you and have a good night. I'd like to end the webinar there.